Sinus pause and escape beats. When we studied the premature beats, we saw the sequence of a premature beat followed by a compensatory pause. But if you see the upper strip of this ECG carefully, there is a pause between beats 2 and 3. But the preceding beat number 2 is not premature. That means the SA node itself paused for a while and then started beating again. This condition is termed as a sinus pause. A compensatory pause was preceded by a premature beat, while a sinus pause is preceded by a normal beat. Now measure the RR interval, and it is 30 small squares, that is 1.2 seconds. It has no relation whatsoever to the previous RR intervals. And after the pause, normal sinus rhythm has started again. So this is a sinus pause, a pause following a normal sinus beat. In this tracing, once again we see a pause following a normal beat number 2. Now measure the RR interval, and it is 40 millimeters or 1.6 seconds. If the sinus pause is longer than 1.5 seconds, then it is termed as sinus arrest. This is sinus arrest. When sinus arrest occurs, the SA node may recover and resume the function again, as has occurred in this case after 1.6 seconds, or if it doesn't, then some lower ectopic focus will fire an impulse and stimulate the heart. It will be worthwhile remembering here that there are several pacemaker cells capable of firing impulses in the atria, AV node, bundle of His, and Purkinje fibers in the ventricles. But SA node is the fastest and most dominant pacemaker, which does not normally allow any other cell to fire the impulses. But when sinus arrest occurs, the lower centers temporarily escape from the depolarizing impulses of the SA node, and one of them fires an impulse till SA node takes over again. So if this beat following the sinus arrest comes from one of the lower pacemakers, it is called as an escape beat, indicating an escape from the inhibition of the SA node. A careful study of the beat after the sinus pause will tell you the origin of the escape beat. This ECG shows a pause with a preceding normal sinus beat and normal T wave. The escape beat shows a slightly altered P wave and normal QRS complex. So this is a sinus arrest with atrial escape beat. Note the slightly altered P wave of the atrial escape beat. This ECG shows a pause with a preceding normal sinus beat and normal T wave. The escape beat shows an inverted P wave very close to the QRS complex, which has normal configuration. So this is a nodal or junctional escape beat. A nodal escape beat may also show absent P wave. It occurs after a pause of 1.2 to 1.6 seconds. This ECG shows a sinus arrest with ventricular escape beat. Note the preceding normal sinus beat and normal T wave. Then note the escape beat, which has no P wave, wide and bizarre QRS complex, and T wave in opposite direction. So this is a ventricular escape beat. A ventricular escape beat occurs after 1.8 to 2.2 seconds. So to revise, whenever you see a pause, first study the preceding beat. If it has occurred early, as in the upper strip, it is a premature beat with compensatory pause. And if the RR interval is normal, as in the lower strip, then it is a sinus pause with an escape beat. Now if it is a premature beat, study the QRS complex, compensatory pause and P wave to decide the origin of the premature beat. And if it is a sinus pause, study the succeeding beat to know the type of escape beat.